Starting.
Yes.
Hello, I am Dr. Vishwas. I am a doctor of this clinic. May I confirm your name and age, please?
Yes, doctor. I am Andrew Garfield, 40 years old.
Okay. How can I address you?
You can call me Andrew.
Okay, Mr. Andrew. How do you feel now?
Doctor, truly speaking, I feel quite better now. Uh, since I got admitted, and I think uh, since I got here, actually, uh, I think I have been examined, and you gave me some medication. I took the first dose of it, and already I am feeling that I've been getting a bit better.
Yeah, that's fine. I'm happy to hear that. And is it okay if I discuss about your management plan with you now?
Yes, doctor, please.
So, do you have any idea what is your diagnosis or why you have developed this symptom?
Doctor, I don't know, doctor, but actually when this pain took place, it was very quite severe, doctor. Okay, quite severe back pain, and also the pain went to my legs. So I'm very worried, doctor. What's the cause of it? Although you have given me some medication, you told me to take the first tablet. I already take it. You have taken it. That painkiller, I think. I am feeling a bit better now, but I'm not convinced, doctor, because one of my uncle, he had so severe back pain, and then I think then he was diagnosed with having I think a blood related problem, doctor. Okay, so and he had to suffer a lot. So I would like to know, doctor, that do I have that same problem or same problem or not? What will happen to me then?
I am sorry about your relative's condition. And before I give you the answer, is it okay if I ask you a few questions?
Yes, doctor. Yes.
Okay, so you have this pain for just 2 days. Did you have ever pain this before?
Sometimes, doctor. Sometimes when I work a lot, and actually, you know that I am a salesman. Okay, uh, I'm a salesman. I'm a wandering salesman. Actually, I have to go to houses, so I have to travel a lot in the day. So at times when I have long shifting hours, I think I feel a bit back pain.
Okay.
But never I have felt it so severe like this.
And sorry. And did you ever feel this pain at night?
Doctor, I think that when I take rest, doctor, I think I feel a bit better actually. So at night, I think usually, I think at times I feel better when I go to sleep. I think it's a bit better.
And how about your water work
Doctor, I think it's quite good.
and your bowel habit?
I think quite good, doctor.
And do you have any weakness in your legs?
No, doctor, I haven't noticed, doctor.
Any changes in the sensation in your legs?
No, doctor.
Okay. And have you ever noticed any lumps or bumps or raised temperature over the pain area?
No, doctor.
And how about your appetite?
Doctor, I think it's quite okay, doctor.
How about your weight? Have you noticed any changes?
No, doctor.
And do you have any night sweats or fever at night, waist temperature at night?
No, doctor.
Do you have any headache?
No.
And Actually, I have asked you all this question to rule out if there is anything that is severe, and it is apparent that you feel this pain when you do mass work or when you have to exercise more. At that time, you feel this pain. Is it right?
Yes, doctor, I think so.
And actually, for this type of condition, that pain, when pain increases following exercise, following excessive movement, we call this mechanical pain. And in your case, it is we call it mechanical back pain. Do you get me?
Okay, doctor.
And do you have any idea about the management of this mechanical back pain?
No, doctor, I have no idea at all.
Okay. And actually, for this type of pain, that is mechanical back pain, we just give the patient some painkillers and teach them some exercise maneuver. Okay, and also give them some advice to avoid certain type of works. For that, they feel better. And actually, this is condition related to work stress, and this is not related to any bad things, any that you are suspecting that your one of your relatives had. And this is not related to that. This is totally a normal condition, and any people, even I or anyone else with this type of situation, can develop this type of pain. Do you get me?
Well, doctor, how can be so sure that I have nothing serious, doctor? Don't you know, need to do more tests? You just took my history, did some examination, and you're telling that you're quite sure. How can you be so sure, doctor?
Actually, we have to read, we have to go through a certain questionnaire to diagnose if it is case is severe or not. And I have screened all the questions and we have examined you, and all this came out that this is not severe. And all these are suggestive of that this is a condition that we call mechanical back pain. Do you get me?
Well, I thought I think that. Well, can you now please guarantee that this pain will never come back to me?
Yeah, as I have said you that with some painkillers, with some advice from the physiotherapist, and also learning some exercise, that will usually help you to feel better. And I cannot, though I cannot guarantee that this will not come, but the severity will be reduced, and with avoidance of certain words, with making, with doing some exercise, that will definitely help you, and that will make you feel better.
Well, doctor, okay, what you're telling is right, but can't you? I'm very worried, doctor. Can't you just do? I've heard that some X-ray can be very helpful to find out any problem. Can't you just do this, doctor?
Yeah, actually, you heard that is partially true. And may I know that do you have any idea about the X-ray, its side effect, its good effects, or its bad effects?
No, doctor.
Is it okay if if I tell you more about it?
Yes, doctor.
Okay. And actually, the X-ray is a certain type of heat that produces some imaging of our bones. Okay.
Okay.
And it is beneficial, and we would certainly do it if we thought that it is necessary for you. But again, we are not doing this to everyone, because it is also coming out with certain type of bad effects. And itself, this type of test can increases the risk of cancer also. On this type of test have some bad effects. So when we assess that this type of bad effects is very less than the test can bring the good outcomes, at that time we can only do the test. And in your case, certainly it is sure that you have mechanical back pain and you don't need any test or any other certain risky test for you, so we are not going for that. Do you get me?
Well, doctor. Well, I get you, but doctor, I want to ask another thing that I actually had some other um, problems with my with my uncle. Actually, I took some care with him for of him. He actually did some other things. Okay, he actually did some I think some MRI scanning as well. So what about it, doctor?
I think I understand that you have an idea about that, and that is also another test that can detect certain problems. Okay, and that is also a costly test that costs a lot of money. We are not only talking about the cost, and that test certainly would we would recommend you if that would be indicated for you, or that if there was any indication for that. And in your case, it is totally a harmless condition. It will not be anything bad. So we are not going to make anything for you that is totally unnecessary for you.
Okay, doctor, I get it. So, you're telling that you're quite sure that it's not a bad thing, this back pain.
As we have assessed you, it is totally a harmless condition, and it is a condition that many of the people have this condition. And for this, I can give you some websites links, some address, some leaflets, so you can get better idea and you can have a good idea about this condition, so you can get the very good idea about this.
Okay, doctor. Well, what will happen? Suppose you are telling me now this that this can actually cause problem. Even the tests can cause bigger problem to me. You are what you are trying to say, as far as I can understand. Am I right?
Yes.
Okay. So, what will happen, doctor, if I don't get well after um, even after having those medication? What can you will you then run the tests?
Okay, actually, we will follow up you through your GP. We will give you advice on this discharge, and we will teach you certain exercise, and also you will have to follow certain lifestyle. And with that, it is likely that you will improve. And even if you don't improve with this, we will go to our next level of management plan, and we will assess you at that time accordingly. And at that time, if it is apparent that you need to go for the test, certainly we will go for that. And at this stage, it is totally sure that it is not a harmful condition, and you don't need any test at this time.
Okay, doctor. All right, doctor. And okay, doctor. And another thing, you saw
2 minutes
once you were
remaining.
once you were telling about that, I think that issue about my health. Sorry, about my job. What have is there anything that that I have to do about my job?
Yeah, actually, we will get advice from the occupational health therapist for that, and they will assess your job, and they will try to make any relocation or make any arrangement that so that you can do that job in that way.
Okay, doctor. Okay.
And do you have any question?
No, doctor. I think it's quite good. I think you have more or less said me everything.
And, do you have any concern that I can?
Doctor, I'm don't have that much concern now. I think that I'm just waiting to get better, and it would have been better if you ran some more tests. But okay, you are so reassuring me so much. Well, let's see what happens, doctor.
Okay. And I am going to make your discharge plan, and I am going to inform your GP so that they can follow up you accordingly. Okay.
Okay, doctor.
And at this time, I am going to give you some leaflets, some website ideas, so that you can get a better idea about your condition.
Okay, doctor. I think that will be helpful.
And even if you have any question, if you have any problem at any time, that you can always reach us. We are always here to help you. Okay.
Okay, doctor. That will be very
Okay. And thank you. Time up.
okay. So how do you think the case went?
Sorry, can you please ask again? I couldn't hear.
Yeah. How do you think the case went?
Okay, actually, Mr. Garfield was diagnosed with mechanical back pain. I have taken history for his red flag signs, and he doesn't have any of that. And for this, also with our previous assessment, this was diagnosed as a case of mechanical back pain. So I reassured him, and I also been able to convince him that at this stage, no test is necessary for him, because that will also bring him that will also come with some side effects and also will cost him money.
Yes, okay, okay, that's all right. And one thing that was there any multidisciplinary approach needed in this patient?
Yes, I have informed him that I will involve the GP, involve the occupational health therapist, and involve the physiotherapist for his better management.
Okay, did you? I cannot remember. Did you tell it specifically?
No, I didn't tell specifically that I will need inform artist whether I have informed him that I am going to involve them.
Yeah, but I think you could have told it specifically as well. I think it would have been much more reassuring for the patient.
Yes.
Okay, because the patient was actually a bit worried. And another thing, could you have asked about his home condition, since he has now some some leg pain as well?
Okay,
Does it do-
I really forgot that, and I should have asked about his driving issue and his home condition, if he needs any adjustment at home or not.
Yeah, I think because I think in this case, these issues would have been very important.
Yes,
Okay.
certainly that would be important, but I forgot.
Yes. Otherwise, it was quite well, but I think these issues should have been addressed. Others have been well addressed because you asked some specific questions, whether there were any warning signs present or not, or any. Yes. So that was really good, but you missed that point. I think these points in patient welfare, I guess. Okay. And do you yourself want to add anything? I think rather, I think it has been done quite well.
Okay, I cannot remember much actually about this.
I just remember these things. Okay. Otherwise, it has been quite well.
Okay, fine. Thank you.
Thank you.